$35 insulin has gotten everybody's attention in the Medicare world. I'm going to talk about it in this video. Stay tuned. So in May, President Trump announced $35 insulin, and everybody rejoiced because, as we know, the price of insulin has skyrocketed over the past couple of years, and a lot of people are choosing between their insulin and their food or their utilities. So this is a very important topic, not just to seniors, not just to people on Medicare, but to everybody. But this $35 insulin is only for people on Medicare. So I don't know why they got a kid here, because this is not influencing if you're on a group health plan through your employer. This is for Medicare. So let's talk about the average savings. People should expect to see $500 to $700 a year in savings, but it's not available on every insulin, and it's not available with every insurance company. So let's talk about a standalone drug plan, a Part D plan. They're going to have a basic plan and an enhanced plan. The cheap plan, the more expensive plan. It's never going to be on a basic plan. It will only be on the enhanced plans. So you will say, so I'm getting a discount on my insulin, but the enhanced plans cost more. The monthly premium's more, the deductible might be higher, the copays might be higher. That is true. However, when you do the math, even the government says that the average person taking one of these insulins that is included in the $35 plan should still save $500 to $700 a year, or about 66% on your insulin. So that's something to rejoice about. But it's not as simple as everybody's got it, insulin just got cheaper. You have to see if your insulin is included and if your company is participating, because not everybody did. They had to apply to participate. As of last month, I think there were over 1,700 plans that did have some of the $35 insulin, but they don't all have it. Okay, so this is a time now more than ever where you really need that insurance expert. Again, you don't pay to have us. We don't cost you a dime. So call us, email us, text us, see the number on the screen, and let us explain to you how this can save you money if you act now, because now is the open enrollment period. So it started a few days ago in October through December 7th. You can change your drug plan. It won't go into effect until the first day of next year. So it's not going to start saving you money on your insulin right now. How does it work? So this shows you how Part D works. You have your deductible, and the deductible for next year went up. It's now $445. Carriers on the deductible, that's something that people don't understand. They don't have to have a deductible. They don't all have a deductible. The ones that do, they might not apply that deductible to every tier of drug. So keep that in mind. I have some other videos just on Part D that you can search in the library. But that's $445 for this year. Then you have your initial coverage, your coverage gap, your catastrophic phase. And if you've been on Part D, you understand these different phases. The insulin doesn't play by these rules. This $35 insulin, this special program, is going to be $35 at all phases of your drug. So it's not subject to the deductible. Initial coverage phase, you still get it in the gap, you still get it at the same price throughout the phases. So that's good news. If you go and you try to do a search on your own, it's confusing. And especially at this time of year, not all of the companies have all their rates updated with the government. So there might be some disconnect and you get a different rate than your agent tells you. And that's why. Just remember, if you're going to enroll trying to find that insulin, it has to be an enhanced plan, not in the basic plan. And you won't start seeing that savings until January. If you're new to insulin and you're trying to help one of your family members, there's insulin. And then there's some drugs that accompany insulin that help it perform better. I just call them boosters. And those are not included in the $35 insulin program. So some people spend a lot of money on that additional drug, and that's not being reduced in this. You'll still have that full retail. We also have people that have an insulin pump, and they get their insulin through the doctor's office, which is under Medicare Part B, as in boy, and not Medicare Part D, which is what I was talking about here, which would be a Medicare Advantage or standalone drug program. So if you're getting insulin and you have a pump and you get it through Medicare Part B, that's still the same as always. That's not impacted by this new government program. Will this program stay around? We don't know. This is a demonstration project, and hopefully a lot of people are going to sign up and be happy in 2021, and we can have this institutionalized and made permanent. So if you have questions on your insulin, give us a call at the Medicare Family. My family would love to help your family.